skin. First, we have Howell-Evans syndrome, which is present. It's an autosomal dominant condition, and there is a presentation there'll be one is like oral leukoplakia, which frequently occurs, and other than that, the main thing is focal palmoplantar keratoderma, which is there. It's also known as silosis, and the cancer which we are talking about in them is esophageal carcinoma. So the carcinoma which is present. So along with that, this association. Then Gorlin syndrome, on the other hand, is also known as nevoid basal cell carcinoma. The basal cell carcinoma is present. Along with that, other things which you can appreciate in them is mandibular odontogenic keratolysis, skeletal anomalies, abnormal calcifications, and dyskeratotic pits, which you can appreciate in the soles, palms and soles. So if they ask what are the causes of the pits of the palms and soles, you can mention this as one of the reasons. Other than that, in the brain, they can have medulloblastoma and the ovarian tumors which are there. That's about the Gorlin syndrome. Then coming to familial melanoma syndrome. In this, we have a lot of large and irregular nevi which is present, and they'll have early onset. Those nevi might turn into melanoma, so which will be early onset melanoma. Family history will be there of that of melanoma and the multiple atypical nevi which are present. So the mutation, germline mutation is that of CDKN2A, which is a germline mutation of that one in 9p21 gene region. So CDKN2A, germline mutation of 9th chromosome which is present, and mutation that impair then even the P16 function will increase the risk of pancreatic cancer. So the pancreatic cancer and the melanoma are the two important cancers which is important. The familial melanoma name itself is saying that they are prone for the melanoma cancers. So what we need to remember is that of CDKN2A germline mutation which is present. Then VHL, that von Hippel-Lindau disease which is present, is an autosomal dominant condition. The mutation is of that of VHL. 3 letters are there, so it's like chromosome 3. So what are the malignancies? Benign or malignant tumors which are involved in this is first of all hemangioblastoma of that of CNS. Below the CNS we have retina. So in the retina we have angiomatosis. Then pheochromocytoma, renal carcinoma, pancreatic adenoma, carcinoma, and cysts which are present. So this, like, you can remember the pancreas which are present, then pheochromocytoma as well as the renal carcinoma of this one. In the head and neck, the hemangioblastomas of the CNS and the angiomatosis of the retina which is present just below. With respect to the skin, which is important for us, is the hemangiomas and cafe spots which are present. Then coming to the neurofibromatosis. Neurofibromatosis and the tuberculosis are the two important things which is important for the spotters as well as if you are studying in the final exam. So both of these are autosomal dominant. So neurofibromatosis means they'll have a lot of cutaneous and flexiform neurofibromas which are there. So along with that, the cafe macules will be present. Cafe macules. Then after that we have freckles like axillary freckling and inguinal freckling. Axillary freckling which are there are known as growth sign which is present. Then after that we'll have in the iris, the pigmented iris hamartoma which is present are known as Lish nodules. So we have NF1 and NF2. NF1 which is there, how do they present with? We have juvenile myelomonocytic leukemia which is there in the neurofibrosarcoma and optic gliomas. Whereas on the other NF2 is there. No, that's why there's a bilateral vestibular 2 years which are present on the other side. Then not only vestibular nerves, even the peripheral nerve schwannomas can be appreciated in them. Meningiomas are important ones. NF2 means you should remember it's meningioma. Then we have spinal tumors from the way down. The meninges can be present in the spinal cord as well as, so the meningeal tumors can also be seen in them. And coming to tuberous sclerosis is also autosomal dominant like that of NF, but here the gene which is involved is tuberosclerin. So TS1, 1 and 2. Here the cutaneous angiofibromas which are there will be there. Then ash leaf macules, the hypopigmented macules, spots, Chagrine patches are the different cutaneous things which are present. Then we'll have Crinean tumors. Oral may what you see is the oral mucosal fibromas and dental pits. Other than that, main associated tumors which are there are intracranial cortical, subcortical tumors. In the heart, there is a heart. sorry, there is a lung, and there is heart. In the heart we have cardiac rhabdomyoma. In the lung we'll have lymphangiomatosis. Then in the renal we have renal angiomyolipoma, which is present. Then this same thing will undergo some sarcomatous changes, which can occur in case of this angiomyolipoma of that of the renal, and the cardiac rhabdomyomas, which is then coming to this is the kidney tumor and the angiomyosarcoma, which is uh, angiofibroma and the kidney tumors, which we saw. Then next we have the angiofibromas are not only seen over here. We can see the here in men's syndrome also. Like see, they might ask if the angiofibroma is present in the tuberous sclerosis, which other conditions might be seen. So we need to remember this one. So coming to the familiar man syndrome, men 1 is there, men 2A is there, men 2B are there. So men 1 which is there is Werner syndrome. Then we have something known as Werner syndrome, which is kind of premature aging condition and a DNA repair disorders which comes. Uh, so in that we'll have different features overall. So Wormer M for the men 1 syndrome, M for the Wormer syndrome, which is there will be there. So familial cancer syndrome affecting the parathyroid gland. Then we have pancreas. Then we have pituitary glands which are present. So if there is mutation in the MEN1 gene, especially the MEN1 is 11 chromosome. Then we have MEN2, which is there is a chromosome 10. Then MEN2B, mentioned. Yeah. So those are the different kind of things which we should remember. But see, if overall, just to overview. In the men one, we have the from the top, it's first one. So pituitary adenoma will be there, and parathyroid hyperplasia, which is actually common between men 1 and men 2A, which is there. Other than that, pancreatic, all the P's, 3 P's. So that's why men 1, when they say, you should remember the 3 P's: pituitary adenoma, parathyroid hyperplasia, and pancreatic tumors. Then men 2A, which is there, in that again we already saw that parathyroid hyperplasia is there. Then medullary thyroid carcinoma and pheochromocytomas. So the P over here will be the pancreatic tumors, and then pheochromocytoma in the men 2A. And coming to the men 2B. Men 2B may we have 1P and 2M, which is present. 2M actually, 3M to be frank. Pheochromocytoma, see from here what is passing is parathyroid. From here what is passing is these two things: medullary thyroid carcinoma and pheochromocytoma. So other than that, mucosal neurofibrinomas are extra thing which we should remember in 2B, and marfanite body habitus, the long extended fingers and extremities which are present. Then coming to the men 1A in particular, familial cancer syndrome affecting the parathyroid, pancreas and pituitary glands. So men 1 is seen on the chromosome 1. We saw that what all features are seen in them. We have this so we saw that in them we have all this men 1 pituitary, parathyroid and pancreatic. Other than that, what is important with respect to the cutaneous features is angiofibroma, which was also seen in the tuberous sclerosis. Then we have cholangioma, the back of the person. Then lipomas. Then cafeolymicals. Again, this condition also have cafeolymicals. 100% of the cases have enteropancreatic lesions, especially the so-called pancreatic neuroendocrine tumors. The incidence of tumors is as follows, like in the pancreas: Zollinger syndrome 54%, insulinoma 21%, glauconoma 3%, and then we have VIPoma, that is vasoactive peptides 1%. So also insulinoma, glauconoma and VIPomas are the different tumors which is present.